am Dr. Naisha Bunnett with Nurse Doc Tutoring Services, and today's lesson will be on how to read medication labels and answer dosage questions from them. All right, so let's look at our first example. So we have a digoxin label, and it says that the patient weighs 45 pounds. The order is for a digoxin 6 micrograms per kilogram orally twice a day. Available, you want to look at the label, and how many mLs will be administered per dose, round to the nearest 10th. All right, so first we're going to start off with looking at our label. So we got to feel about label and what we're going to kind of pull from our label. All right, so first we want to start off by converting our pounds to kilograms. So 45 pounds, divide that by 2.2. And that will give you 20.45 kgs. So when it comes to rounding, make sure that you're going by what your school says when it comes to rounding. All right? So we got our weight in kilograms already. All right, so now we're going to move on to, let's think about some other conversions that we could have to do as well. So our order is in micrograms, but our label is in milligrams. So what do you think we would need to do? We would need to convert that as well. All right, so let's start off by doing the conversion. So we have your 6 micrograms. And all this is from the problem over kg, right? So our kgs are going to cancel out. And while we're here, we might as well cancel out our mcgs. You agree? Might as well cancel those out. So we know that 1,000 mcgs equal 1 milligram. All right? So let's pull now from the label. It says that it has a 0.05 milligrams per ml. So, ml goes on the top. How do we know that ml goes on the top? Because mg is up here and we need mg down here to cancel out. So, and it says 0.05 mg. All right, so let's cross out. So, kg, cross out kg. Microgram cancel out, milligram cancel out, milligram cancel out. So all we're left with is milliliters. And that's what the question is asking for, right? Milliliters. So let's do all the work. So multiply straight across. So 20.45 times 6. I got 122.7, and then you got 1,000 times 0.05, and that is 50. All right, so we're going to divide 122.7 divided by 50. And we're going to get 2.45. So we're going to round to the nearest 10th. And our answer is going to be 2.5 mLs. All right. We're going to do another one of those because those can be kind of tricky. So let's try another one. The next problem says digoxin. I love digoxin, right? So digoxin 0.125 milligram is given orally once a day. Available, see the medication label. How many tablets should be administered per dose? Round to the nearest 10th. All right, so we're going to start off by what we have, right? But we know that we need to end in tablets. So I always like to write on this side, hey, whatever we do, we need to end in tablets. All right, so we're going to start off with what we have. So we have 0.125 milligrams. All right, so we have milligrams, and we know that we're kind of in trouble now with milligrams because our label is in micrograms. So what are we going to do? We're going to do a conversion. So if you look on the label, they have already done the conversion for you. But let's just take it straight on out. Let's say they didn't. So 1 milligram is 1,000 micrograms, right? All right. So now that we're in micrograms, we can go pulling from the problems. So 250 micrograms. Micrograms has to go on the bottom so it can cancel out, right? We cannot cancel out side by side. And what goes on the top? Tablet. Because for every tablet, it is 250 micrograms. So we can cancel out our MGs, cancel out MG, MCG, MCG, and what are we left with? Tablet. And what do we need? Tablet. All right, so let's put that, let's multiply straight across. So 0.125 times 1,000. And that will give us 125. And then 1 times 250 will give us 250. So we divide that. And our answer is 0.5 tablet. So this is what? A half a tablet. So let's say that you got an answer that says 0.1. We know that we cannot give 0.1 of a tablet. Even though the question says round to the nearest tenth, that could be if you were at 1.9 or something. That means you can round to the nearest tenth and you can round to the nearest whole number. But normally on your tablets, you're going to always go with your whole numbers, unless it's like a half a tablet where you're able to like split it. So you're going to give a half a tablet. All right, I think you guys are doing good. Let's try one more. So I switched it up from digoxins. All right, this one says the order is acetaminophen 480 milligrams orally every 6 hours for pain. Is available as it is on the label. The patient does not have a measuring spoon for milliliters. How many teaspoons should the patient administer per dose? Round to the nearest whole number. All right, so we're going to start with what we have. So we know that we have 480 milligrams, right? And then we're going to come over here, and what do we need to end in? We need to end in teaspoons. All right. All right, so back to the 480 milligrams. That's what we have. Now, let's go to see what our label says we have. So the label says it is 160 mgs over 5 mLs. So 5 mLs goes on the top. 160 mgs go on the bottom because they have to cancel out. All right, so now we're left with milliliters. Is our answer requiring us to be in milliliters? No, it's not. It's requiring us to be in teaspoons. But we're so smart, and you guys are so smart, we know how to convert mLs to teaspoons. So how many teaspoons are in, how many milliliters are in a teaspoon? So there are 5 milliliters in a teaspoon. All right, so mLs cancel out, mLs cancel out. Now let's work. So we have 480 times 5. And that will give us 2,400. And then we have 160. We're just multiplying straight across. Times 5, and that will give us 800. All right, now all we have to do is do 2,400 divided by 800, and we will get 3. So this patient would get 3 teaspoons. Did that make sense? I think you guys are doing so awesome. I know you guys are catching on super fast. So that is it for this session. I know that you guys are crushing it. I pray that you guys are getting a better understanding of your nursing math questions. If you have any questions, please leave them in the comments. And if I sound like I could be a perfect tutor for you, the information is below. I would love to tutor you. I would love to help you reach your dream of becoming a nurse. You guys have a great day. See you on the next video.